into the area of your stroke, this little sliver right in here is your stroke. Okay. You can see it kind of light up. It was starting to kind of show its ugly head right there. And then as we descended down into the midbrain, that's really near the brain stem, it only takes up about maybe 4 millimeters. So, because it's on about 3 slides, 2 to 3 slides. And so that is the area of giving you all of these symptoms, okay? Now, to give you a little perspective, this right here, this area surrounding this is the pons, this is the cerebellum. That is the balance center of your brain. So this being the balance center, and this being the area of kind of some fine motor control. This is why you have troubles with certain kinds of balance and coordination. And that's why when you get up on your own 2 feet, things are a little, you've got your sea legs, so to speak, you're a little wobbly. That's why, okay? So seeing this is a little bit easier to understand why you're having these problems, okay? Now, ever had a stroke before, sir?
No.
Well, we've looked at the echo of your heart, which is using sound waves to go through the outside of your skin, looking through your fat, bone, and muscle, through your heart using the sound waves. We look at the heart's function. The ejection fraction of your heart is 70%. Normal numbers are 60 to 70. So you've got a good strong heart. Now, you do have a little bit of some leaky valves, which I would say is slightly common in a 68 years young gentleman. And so we want to make sure, what we look for is reasons for this stroke. What we're looking for is A, blood clots inside the heart, B, holes in your heart, things where blood can squeak through or get to places where it doesn't belong, okay? We don't see either of those things in your case, okay? No blood clots. And then we look to see whether or not your rhythm is good, your rhythm of your heart. Not whether you can dance, but your rhythm of your heart looks very good, okay? It doesn't show anything like AFib or atrial flutter, which is ultimately kind of what we're also looking for as potential causes for these kinds of strokes, okay? The lab values that we look at, looking at your blood, your hemoglobin A1C is 7.3, so your diabetes is moderately controlled. I like numbers less than 7. I'm not going to throw rocks at a 7.3. That gives you your average daily blood glucose is a 163. Okay. Your LDL cholesterol is high. Okay. Now, normal numbers, because you've had a stroke, per the American Stroke Association, says it needs to be under 70. Yours is 144. So, we've got, now you were on Lipitor, a cholesterol medicine prior to this, is that correct? Let me take a look here at your...
That doesn't sound
I
familiar.
remember, yeah.
Also called atorvastatin.
Oh, okay.
Yeah.
Yeah.
Sorry,
I was on that.
that's the brand name. Atorvastatin is the generic. And so those are the medicines that help keep our plumbing clean. And it's doing its job as far as the plumbing, not letting that hot molasses stick to our plumbing and narrow it down over time. Kind of like your wife's shower drain, how that conditioner sticks to the plumbing and you've got to pull out that hairball every now and then. Your plumbing is the same exact thing, okay? So what we eat, what we don't use, gets into the blood and sticks to plumbing. Well, the Lipitor helps prevent that from getting into the blood and getting that up. However, we need to ratchet up on your dose of Lipitor a little bit and get those numbers down because of this stroke, okay? Now your triglycerides, now this was drawn at 2 a.m. It was resulted at 2 a.m. this morning. So it may be, now it has to be, you have to be fasting for so long prior to this exam. So you may have eaten something that was kind of a high fatty food, before this was drawn, and that can throw off the results a little bit. But you know, nonetheless, we look for overt causes of stroke. I don't see anything to really jump up and down about on this test of this lab values, but we do need to bring your LDL cholesterol down a little bit, okay? Obviously, diabetes does place you at an increased risk for stroke, and so tightening up on your glycemic control while using your primary care doctor, you know, to kind of help you do those things is very important. It sounds like you're doing a good job, okay? We've got you on, were you on aspirin every day before this happened?
Yes.
Okay, what dose of aspirin?
It's a Bayer low dose.
Okay, so we're gonna ratchet that up to 325 milligrams every day, as long as your stomach can handle it, okay? 81 milligrams of aspirin, if you were on that before this happened, we've got to escalate your antiplatelet therapy because of that, okay? Let's see. Take a look at your blood pressure over the last few times here. Blood pressure's been really high. It's been really high for a reason, okay? We're holding all of your blood pressure medicines at this point because we want that blood pressure to be pounded around that area of clot, whether it be plaque or blood clot. We can't tell the difference, okay? We want to get that blood flow around that area so that we can get it into the nooks and crannies to help mitigate, you know, the lack of blood flow to the other areas that stroke has caused, because it's a blockage. So that plumbing that's around it or next to it or things like that can also be affected. So we want to make sure that we increase the blood pressure, we keep it that way for 24 to 36 hours. And now we're going to start ratcheting back down on that. So we'll start tightening back up on your blood pressure. Has your blood pressure been kind of hard to control at home?
Yeah, at times.
At times, okay. And so you're not currently going, I'm just looking purely at your history here, okay? You're not currently undergoing any treatment for your prostate cancer or anything like that, right? Or is that old?
Yeah, I had radiation therapy in 2014.
14.
Oh, okay, so you're not getting treatment for it
No,
now though, right?
no.
So it's old, okay. Let's see. Yeah, so ultimately, you know, your stroke workup is completely done from my perspective. You know, you've got the right lower extremity and the right upper extremity. Have you noted that it's kind of returned to normal, or does it still feel a little weak, or?
It still feels weak.
Yeah, and are they recommending rehab for you?
I haven't talked to the doctor, but
Let's see what
a
it
couple of people mentioned that's probably what's going to happen.
Yeah, OT, occupational therapy, as well as physical therapy, say that they're recommending inpatient rehab. Are you willing to go?
Yeah.
Okay.
Where's this? You know where this place is?
It's probably Health South. Now, it does depend on whether or not your insurance agrees with Health South, but I see Christus Medicare replacement is what you've got.
Mm-hmm.
Obviously, it'll probably, because they're a Christus company, you know, they're affiliated with us, so they should not have any problems taking your insurance. However, it does need to be approved and all of that stuff.
Oh,
That's
okay.
above my pay grade.
I understand.
So for right now, it's kind of one of those things we say, okay, let's get you to rehab, see what we can get back, and motor-wise, strength-wise, coordination-wise, and then we're going to keep picking on you in the clinic perspective. Do you have a neurologist?
No.
Okay. Never seen a neurologist for any reason?
No.
No.
So what we're gonna do is bring you over to the clinic in about 60 to 90 days, okay? That'll allow you to get through rehab, get back home, see how things are going good or going bad. That will determine your next follow-up appointment. So, you know, generally rehab is between 12 to, is between 2 weeks to 3 weeks inpatient, generally. Some people get complete it in 3 days and they're like, hey, I got this. You know, other people take a little bit longer. So that will determine basically our next follow-up. We're gonna make an appointment for you in the next couple of weeks. We're gonna call you to set that appointment up. Where's home for you? Here in Tyler? or-
Lighthouse.
Oh, okay, so you're fairly close. I didn't know if it was like Texarkana or something
No,
like that. Because we do receive patients, you know, from that far away from time to time. So, other than that, your stroke workup's fairly completed. The only really thing that I'm gonna change to your daily medicine is, like I said, your aspirin. We are gonna go up on that as far as that goes. Now, are you on any blood thinners or anything? I'm not seeing any, but I always
No.
ask.
No,
Oh, and they just went ahead and stepped you up to Plavix, 75 milligrams a day, and that's fine. If you were my father, I would want you on Plavix over this, just because you technically failed aspirin. Does that make sense? And so we're gonna keep you on the other medicine that's called clopidogrel, and that's its generic medication. So that is what we're gonna proceed with.
Instead of the aspirin?
Mhm.
Oh,
Yeah,
okay.
It's like a super aspirin.
Okay.
It works really well. You don't need both agents, okay? Some people will say, well, I want you on aspirin and on Plavix. He does not need that. His plumbing is too squeaky clean for both agents. And so that would just increase his risk for bleeding, which we don't want.
No, yeah.
So let me pick on you for a second. Let me grab some gloves here. Any numbness or tingling at all, sir?
numbness, no.
Okay. Do you have any neuropathy associated with your diabetes?
Yeah.
So you have some numbness to your lower legs? Or is it pins and
Around my
needles?
feet, my toes.
So we also take care of that too, okay? In the neurology department, we kind of specialize in neuropathy. Kind of get you some medicines to kind of help with that. Whether you take gabapentin or not, I don't know. But we'll follow up and pick on you for that as well. Can I answer any questions at this point? I try to make sure that I try to go through everything that we have done, and I know, you know everything that I know, so that when you leave up out of here, there's no, well, dang it, I should ask that guy that question, you know?
I'll
I
talk
have
to you
one.
that
What
later.
caused it?
We really don't always have a slam dunk something that we can hang our hat on with strokes. You know, generally, it's one of those things that we look at, comorbidities. That's a $100 word for other things that's wrong with me. Whether that's diabetes, he has, hypertension, he has. We look at heart function. You know, you've got some leaky valves. You're not 25 anymore. I say that lovingly. You know, we all could afford to exercise more, lose some weight. Do you smoke, drink, chew tobacco, pipe cigar, any marijuana?
Don't tobacco. I have some beer every now and then.
Okay, me too. That's okay. You know, every now and then is okay, but if you drink 6 to 10 every day, you know, then that's obviously an issue. You know, but,
No.
you know, 2 to 3 beers, you know, or 2 beer, anything more than 2 beers a day is technically excessive. Okay, so if it's more than that, I would recommend that you cut it back and don't save them up for the weekend. It doesn't work that way. I have people that say, well, can I save them all for the weekend? And no. It doesn't work like that.
Good idea.
Yeah, that was worth a shot, you know, by George, you know, but our office, let me orient myself here, is right over here in the 3rd floor of the Texas Oncology Building. We're on the 3rd floor of the Neuroscience Institute. I'm a provider there as well. I work over there too. I have a clinic on Wednesdays and Tuesdays. And so what we're gonna do is you know, kind of go from here to rehab, and then in about 60 to 90 days, bring you back in there, retest your LDL cholesterol, see if we have other risk factors, you know, look at your A1C, you know, that'll give us about another 3-month window to get a better picture of that. Give you an opportunity to see if you're gonna make any modifiable risk factor adjustments, lose weight, diet, all that stuff. And then if we need to tighten up on some other things, we do that. And then we'll obviously pick on you for your neuropathy and any other neurological problems that you may be having. Okay? So, do me a favor, squeeze my fingers tight like a pair of pliers. Good, pull me to you. I pull back. Good, push me away. Good, good. You feel me?
Hmm?
Feel the same?
Yeah.
Good. What about up here?
Yeah.
Feels the same? Follow my finger with your eyes without moving your head now, no cheating. Do okay when you go side to side like that? You don't get swimmy headed or anything?
No.
Look right here where my nose normally is without this stupid mask on. I'm so over this corona crap.
Mm-hmm.
I'm about ready to go lick the fork of the guy that's got the damn thing just so I can get over it. Bring this leg up, hold it up like this. I want to push it down, don't let me. Good, over here. Hold it up. Okay, push straight out into my hands, both. Good, pull backwards, straight back. Good. Now toes up for me, hold them up, heels on the floor, hold. There you go, hold them up. And push down. Good. You feel me here?
Yeah.
Good. All right. Hold your hands out in front of you. Hey. Close your eyes for me.
Hi.
Take this finger and put it on your nose. Excellent. Switch hands for me. Okay. Good, good, good. You're doing good. That side is the reason why that stroke is what's causing this side to misbehave.
Yeah.
The discoordination, and like you may want to reach for a glass of water that's full and you'll knock it over, you know, because your proprioception, meaning knowing how something close or far is with depth perception, things like that, is affected from this. You can get over it, but the pontine, that area where the stroke is at, is a very, very high real estate area. It's like beachfront property in real estate, okay? A little bit of property is gonna cost you a lot of bit of symptoms. Does that make sense?
Mm-hmm.
And so, you know, you're likely gonna do okay with it, but when you get tired, when your blood pressure gets really high or really low, or if you get sick, like in the future even, sometimes that scar, it's a scar, that's dead brain tissue, okay? You don't get it back, unfortunately. That area of stroke can rear its ugly head from time to time, and you'll get symptoms again. And you'll be like, man, I just don't, I'm real tired, and I just feel like I'm having this stroke all back over again. Well, that's because it's kind of rearing its ugly head again because you've gotten tired or whatever. So, you know, hopefully with more time that goes on, those symptoms will kind of mitigate, but we don't want another one, so that's why we're gonna pick on you moving forward.
I don't want to.
All right, well, we'll keep you that way, hopefully, okay? So Plavix moving forward, we're gonna increase your Lipitor, atorvastatin, and we're gonna go from there, okay? We'll get you to rehab and put the spurs on and kind of keep on keeping on, all right?
Okay.
Questions, comments,
I have
correspondence,
another
complaints?
question.
Sure.
A few weeks ago, he started taking Golo. He
Yeah.
was on that program Golo.
What's that?
It's a diet, lose weight thing. I saw it on Fox. And then I was taking
Tea, like
L-arginine. Arginine.
Arginine, yeah. Usually that's just for, so L-arginine or I don't even know how it's pronounced. That is a, I believe that has a direct effect on like things like testosterone and weight loss. And so they typically recommend that for men as far as, you know, to boost that up, you know, as far as if it's a stimulant or not, or if this was a root cause for this, I can't say that, you know. I think it's one of those things that, you know, if you started this right before all of this happened, I would of course not continue it.
Yeah.
You know, the old-fashioned way of, you know, eating a well-balanced diet and just exercising 30 minutes a day and getting your heart rate above 100 to 130 beats a minute is...
I've already decided that if it's not something they want me to take,
yeah, we're not taking it.
I'm not
Yeah.
taking it.
Well, I think that, you know, that's a very smart thing to say, you know, as far as
What, turmeric
turmeric, yeah.
or turmeric?
Yeah.
Okay.
Turmeric is a really good anti-inflammatory for, you know, an herbal type. I'm by no means an herbalist. If you want a kind of holistic treatment only, you know, like herbs and stuff like that, I'm definitely not your guy to kind of answer those questions.
Well, that's why I started taking it, cause there's a lot of it online, of course not everything that's true, but was about your aches and pains and,
Yeah, my dad takes it, and
My mother does too.
my dad shoes horses. My dad's 65, and he's tougher than hell.
well, at one time I was taking some Tramadol for just these aches. You know, I've had both
Joint
hips
stuff.
replaced, and I started taking the turmeric
Mhm.
couple of months ago,
Yeah, he started feeling,
and it just seemed like I was feeling so much better.
Sure.
I was outside, and she commented last week about, what are you taking? You know, how come you're, I
Give me
was just
some.
moving some more. Then this happened,
Yeah.
you know.
I would
But-
say that the turmeric is probably a-okay, you know,
Okay.
especially with, you know, I know it a lot better than I know the L-arginine or L-arginine. I would have to do a lot more reading about it and things like that in order to give you a, you know, a clear-cut answer.
I'll ask Dr. Hottie about it. But
Yeah.
all that other supplements, I'm not gonna take them anymore.
Okay. Well, we're gonna message our schedulers, and I'll take care of that about getting you a booked up follow-up appointment. They'll call you with your time and day. And, of course, we'll see you in follow-up.
Okay,
All right. It was nice to meet you both, and if you have
nice to meet
anything,
you, thank you.
you're very welcome, okay?
Thank
Got a
you.
lot of good information.
What was your name again?
My name's Kobe,
Kobe?
C-O-B-Y.
Dr.
Tara, I'm gonna get your blood sugar for the
Dr.
lunch.
Kobe?
Oh, I'm a nurse practitioner.
Oh, okay,
Yeah.
Kobe, okay.
Yeah, I'm just Kobe.
All right, thank you,
I play a
Kobe.
doctor on TV, though, I'm not really. That's what I tell people. All right. Well, y'all have a good day, okay?
Thank
You look
you.
like Dr. Kildare.